health experts say it may take 3 shots to get vaccinated for the flu this year. And as millions of children head back to school over the next couple of weeks, concerns about the H1N1 virus are ramping up. Our Dr. Jennifer Ashton here with more this morning. Good morning.
Good morning, Harry. Today, federal health officials will lay out major guidelines for schools on how to prevent and manage any possible flu outbreaks.
The H1N1 virus has been smoldering this summer among children, largely in summer camps. So it's ready to, we're afraid, explode once schools reconvene.
In the southern hemisphere where it's winter, H1N1 has become the dominant strain of the flu, infecting thousands. The death toll over 500. A grim warning for the U.S. The Centers for Disease Control present one model predicting 40% of the country, or 140 million Americans, could be infected. Experts say a nationwide vaccination program is crucial, but currently there's no approved vaccine available in the U.S.
There's a bit of a race between the virus and getting the vaccine out there first.
And when there is a vaccine, one teacher is proposing a controversial plan where schools could vaccinate the student body.
If all students are to be vaccinated, and that's the recommendation, then certainly schools as a place for vaccination would be one of the possible strategies.
Until then, schools and families across the country are planning and preparing the best they can.
Amanda's going to be carrying around little hand sanitizing gel.
And I'll have some answers to the most common questions about H1 later in the program, Harry.
So 3 vaccinations?
That's right, Harry. Probably 2 for H1N1 and 1 for seasonal, and it's recommended that people get all 3.
Dr. Ashton, thanks. We'll have more with you in just a little while. Joining us now from the White House is Education Secretary Arne Duncan. Good morning, Mr. Secretary.
Good morning, Harry. How are you doing?
I'm pretty well. A lot of people very, very concerned about this fall and this winter with H1N1 on the way. It has broken out in a really significant way in South America. We're tracking this. Last spring, individual schools closed, some entire districts closed. What guidance is the government giving today to school districts around the country as they're opening?
Yeah, well, I'm viewing this first and foremost as a parent. I have 2 young children at home who will be going back to school this fall, and I want what every parent wants. I want to keep my children safe, and I want to keep them learning. And so we're asking parents to practice common sense, to monitor their children. If children are coughing, have them cough into a sleeve. We're talking about frequent hand washing as well. And we want schools to have a tiered response. We want to prepare for the worst, but also know that we want to get off to a great start to the school year.
So is there a guideline from the government in terms of school districts? Do they know
guidelines? We're going to put out clear guidance, and the decision of whether or not to close schools will always be made at the local level. We want to provide as much facts and information as we can so that local school districts and local health departments can make a good decision. Basically, will be a tiered response. If there are a handful of children at a school who might be sick, we want parents to keep those children home. We want them to plan now to do that. If the numbers start to escalate dramatically, then it might make sense to close the school.
There's still no vaccine. Are you satisfied that the government has pushed the drug companies hard enough to make a vaccine available early enough?
Yeah, folks are working extraordinarily hard, and we've been in constant daily collaboration and communication with CDC, with HHS, with the Department of Agriculture in terms of feeding children. We're anticipating the vaccine will be available in mid-October. We want our schools to be sites for the distribution of the vaccine. So
you'll use schools as vaccination centers?
Absolutely, and we want children to get vaccinated. That will obviously be a parent's choice, and this will be actually a 2-shot vaccine, so you have to do it once and then come back a couple weeks later. But we think schools can be a big part of the solution, and again, we want to keep children learning whatever happens.
Secretary Duncan, I'm sure we're going to be talking a lot more in the weeks to come. Thank you very much for your time this morning.
Thanks so much for having me. Have a good day now.
All right.